All right. Welcome to everyone who's joining us online today. We are talking about Canada's eastern edge as we explore Atlantic Canada. This is 4 provinces, vast regions, both rural and urban areas. And the Atlantic region has 2.6 million residents as of 2025, and they will all need healthcare at some point. So, what exactly is the healthcare landscape in this beautiful and important part of our country? What exactly are the strengths? What are the challenges of delivering healthcare in these provinces? Who exactly is making the most ground in meeting the demands? And are there opportunities for learning and for growth for the rest of the country? My name is Avis Favaro. I'm the moderator of this session. I am a health journalist, and I'm also a senior advisor for Santis Health. I work in media training. And on this session, you're going to hear from regional experts who will give you a big overview of what exactly is going on in the Atlantic zone. And then we're going to zoom into each of the 4 provinces, Newfoundland, Labrador, PEI, Nova Scotia, and New Brunswick. And so here are today's panelists. Everton McLean, Vice President for Santis in the Atlantic region, and you're in Charlottetown today. Hi, Everton. Kathie McNally, a Senior Advisor at Santis, a family physician and former Chief Medical Officer for Health PEI. Welcome, Kathie. And Dr. Brendan Carr, an emergency physician by training, but also has held leadership roles in BC and Nova Scotia. He's in Halifax today. And behind the scenes is Haley Thompson, communications coordinator for all of this and makes the magic happen. She'll also be taking your questions. More about that later on. But right now, for some information about Santis and its work on this eastern edge, here's Everton McLean.
Thanks so much, Avis, and thank you for everybody who's joined us here today. It's a great start to the day. I'd like to start with a short introduction to Santis. Santis is a consultancy that provides first-class counsel and support to clients' healthcare and life science sectors exclusively. And we work at the heart of Canada's healthcare system to influence change. We use deep knowledge of Canada's health and life sciences environment as key players in political landscapes to help Santis clients translate ideas into action and action into change. For every project, we focus on bringing together the right people to solve the complex problems with discipline and care to provide deliverable and measurable impact. Our teams blend expertise in our 3 core service areas, and those are management consulting, communications and marketing, and government affairs. And it's all grounded in real world experience, as we'll talk about today. And we bring deep subject matter expertise in life sciences and digital health to our clients. Whether it's accelerating health systems innovation, guiding corporate strategy, or advancing priorities, Santis is here to help clients stay ahead.
Great. Thank you. Thank you so much, Everton. And there's media training, courtesy me.
And media training.
Yeah. All right. So we're going to have lots of room for questions afterwards. At any point, feel free to pop in your question in the Q&A button down at the bottom, and we'll get to them after the presentation. But you never know, we might throw something in here and there. A reminder that this session will be recorded for future viewing. Those of you who have registered will get a link in your email. Otherwise, it'll be posted directly on the Santis site. And so let's begin with the big picture, and back over to you, Everton.
Thanks so much again. The first one I look at Atlantic Canada, I like to think of it as a region, but also 4 distinct parts. And often when we see people talk about Atlantic Canada, they talk about it as a region. Sometimes in polling and in pan-Canadian reports, we see province, province, province. Then when it gets to New Brunswick, Atlantic Canada is lumped in. And there's some logic to that. Our population, of course, is small. We talk about 2.6 million compared to other provinces. So it seems like a good comparator when we're comparing regions. And of course, our geography looks like the size of a province. But those of us who live here also know that there's a really substantial differences between the 4 provinces. And it's important to look at it as more of a mosaic and how they work together and where those overlapping edges are. Each has its own way of handling healthcare, and that's really important to how people receive care in the provinces. And my colleagues and I will be looking a little closer at those differences soon. But there's a lot of common ground too when I talk about those overlapping edges that we need to be cognizant of and look at those opportunities. Even within our distinctions, there's a lot of things that are happening around population. There's a lot of population growth in each of the four provinces that's been a consistent factor over the past 5 years and longer. So from 2020 to the end of 2024, our four provinces actually saw some of the highest population growth in the entire country. Now, when you look at the numbers, you might say, okay, 2,000 on Prince Edward Island is not a lot of people. But really, when you look at the per capita and how our health system has been developed over time in order to care for these individuals, it's really been a rapid growth. And it's a growth that's new experience for Atlantic Canada. There have been many decades of planning for aging populations and declining growth, and we've seen the opposite. So you see our provinces moving and shifting to adjust to that and to adapt. In 2025, we're of course seeing a little bit of a population reset with immigration targets being smaller, but we're still quite ahead and continue to grow. And we're still working around those changes in population. So you'll see that as a key factor in each of our provinces and in the region. At the same time, that aging population that I talked about is still there and is still part of the system, and of course is needing the care that we always knew it would. So despite the growing numbers of new families, workers, people in that age category, our aging population is growing and needing more complex care. Just last week, CIHI reported that, for example, in Newfoundland and Labrador, wait lists for surgeries were getting longer, even though there's more access to procedures. So the province is doing a good job of growing that access, doing what it can to increase. And yet, because there's still the older residents and an increasing number of need, meeting wait lists and times and key benchmarks is becoming more and more difficult. That's a key factor that requires more investments in things like home care, long-term care, and innovative approaches to managing surgical capacities. When you look at the region too, you'll notice that we're characterized by having large, either single large health authorities or a large health authority and then a specialized health authority embedded within the province. For example, the IWK Health Center in Nova Scotia that provides specialized pediatric care for the whole region. And in New Brunswick, Vitality Health Network, which is unique in that it's a francophone first health network. So those are some very distinct differences in these provinces. This setup means that our province-wide initiatives can be implemented more quickly, and in Atlantic Canada, it makes it an ideal ground for innovation and advancement. If you imagine a small province, one health authority, fewer players, so you can say we're going to innovate and make a change and make a region-wide change or a province-wide change. One good example is primary care. We've seen that across all of the provinces. PEI is a great example. Being able to push the primary care framework around patient medical homes based on the College of Family Physicians of Canada and advance it a little bit faster and ahead of the curve, standing up to 17 homes in Prince Edward Island right now, which is quite a move. Finally, I just want to address that there's been massive and extensive investments in healthcare in each of these provinces over the past 5 years, especially numbers that we previously would have been unheard of. So across Canada, we've seen national spending increase 5.7% according to CIHI. And in each Atlantic provinces, we expect this year their budgets to be increased between 7 and 10%, so outpacing the rest of Canada. Given Atlantic Canada's primarily rural setting with some pockets of urban settings, these geographies really make it difficult to achieve economies of scale across the provinces and across the region. So if you can imagine, you have a center with a lot of capacity around St. John's and Newfoundland. There's people in Labrador who need that service, and there's a lot of cost of bringing them there and moving around the province. And of course, not the population to support duplication of services from place to place. So you see that becoming a fiscal challenge that we'll talk about in the slides ahead. So that's a quick overview of the overall region. And with that, I'm actually going to hand it back over to Brendan to give the first overview of a province with Newfoundland and Labrador.
Great. Thanks, Everton, and welcome everybody. Yeah, so let's kick off by taking a little look at Newfoundland. And we'll start just with the political and population context. So in 2021, Andrew Furey was elected Premier of Newfoundland. And in 2025, he stepped down. John Hogan, who was then Minister of Health, won the party's selection as leader of their party, and so now Krista Lynn Howell is the Minister of Health in Newfoundland. Dr. Pat Parfrey has recently been appointed as CEO in Newfoundland. And Dr. Parfrey notably was one of the co-chairs of the Newfoundland Health Accord, which started in 2017 and was finalized in 2022. Newfoundland's population, as Everton said, is significantly rural and deeply rural. Over 42% of people in Newfoundland live in places that are quite far away from urban centers. Notably, Newfoundland spends on average about $6,900 per person per year for healthcare, which would be compared to the Canadian average of around $5,600 or thereabouts. So it's expensive to deliver care in a province like Newfoundland. Their biggest challenges really are about access to services, as Everton said. They have significant waits for surgical procedures, for some diagnostic procedures. They have, I would say, based on life expectancy, they have an unhealthy population where their life expectancy is less than the Canadian average. And they have recognized that they have issues with the large seniors population and frailty in remote areas, as well as with Indigenous health. And so there's a lot of challenges facing Newfoundland. So what's driving change in Newfoundland? So I referenced the Newfoundland Health Accord, which was completed in 2022, and it really was a very comprehensive look at Newfoundland, health in Newfoundland, and it looked at what are the factors that are impacting health and that could make health, that could improve health in the province. And that health accord really lays out a 10-year roadmap for healthcare in Newfoundland. 57 recommendations, and they're largely grouped into three buckets. One bucket around measures that will improve the health of the population generally. The second bucket are measures that will help to rebalance the health system and ensure that there's just the kinds of resources that are required. So these would be things like investing in primary care teams, investing in the ambulance system, investing in programs that do a better job to support frail seniors, Indigenous health, mental health and addictions. And so the second bucket really is about rebalancing the health system. And then the third bucket introduces the idea of health and social networks. And I think it speaks to Newfoundland's understanding that ultimately to create health in a population, it's about more than the health services that you deliver, but it's actually about the conditions that people are living in and how we work together with assets in a community to try to make the best of what we have, to try to understand what the gaps are and to try to fill those gaps. And so Newfoundland, like a number of the Atlantic provinces, are leading the edge in terms of the evolution from just team-based primary care into this idea of neighborhood-based care or health and social networks around care. The budget for health in Newfoundland in 2025 is about $4.45 billion. And the significant things that have been targeted in the budget in 2025 include significant investments in HHR and human health resources, about $2.4 million for international nursing, about $10 million to support recruitment and retention efforts, $35 million further investments in primary care teams, and things like $3 million for settlement supports for new nurses coming into the province. To date, the province has recruited over 1,100 nurses and 140 physicians over the last year or so with these supports. The next big area of investment is digital health, where the province has already made a significant commitment to a health information system, and this year they're planning on spending about $140 million. But the other big area of investment in digital health is in virtual care, about a $10 million investment. And Newfoundland very clearly is trying to create digital and virtual care resources that are integrated into their care teams. So not as a standalone and not really as an alternative, but they're trying to figure out how best to use technology to lever their teams and to create better access for people throughout the province. To date, there are about 18,000 people in Newfoundland have received 27,000 virtual visits on their existing platforms. They're also investing significantly in backlog reduction, about $10 million for imaging, things like MRIs and other scans, oftentimes things that are required prior to surgery, so that people can so they can get the surgery that they need. They're investing about $15 million in ambulatory care programs, and I think that they're focusing on orthopedics because they have significant orthopedic backlogs. And they're investing about $26 million to upgrade their ambulance system, both air ambulance and ground ambulance. They're investing in mental health and addictions with a $6 million investment. And then they've got a number of things, including vaccines and other screening programs in the prevention range that are about $25 to $30 million of investments. With respect to pharmacare, Newfoundland has a provincial drug program that supports biosimilars. And they are in negotiations with the federal government around the pharmacare program. The other thing that's really notable about Newfoundland is that they have a very mature, I would say, life sciences and innovation hub. And if necessity is the mother of invention, I think necessity lives somewhere north of Deer Lake, because Newfoundland has hit it out of the park in terms of the work that they've been doing around innovation. They've got a mature innovation hub that includes health, their economic development people, their academics, life sciences, and many, many partners from the business community. I visited the hub just after COVID, and they had incubated some of their COVID-oriented businesses in the hub, so developing PPE. They have a space for design thinking workshops and sessions within the hub, and then they have a lot of partnership space, and it's something that is really vigorous. And as much as Newfoundland is spending on healthcare, their innovation hub is definitely creating some economic benefits for the province, as well as health human resource benefits. So Newfoundland is a province that has a very clear roadmap in terms of where they want to get to, and their investments really align to the priorities that have been identified on that roadmap in health human resources, digital health, addressing backlogs, mental health and addictions, and prevention. So Newfoundland's doing a great job. Let's move on to Prince Edward Island. Prince Edward Island, so Dennis King was elected premier to a majority PC government in 2023. Mr. King also stepped down in February 25, and so Rob Lance is the interim leader of the party on PEI, and currently the Minister of Health is Mark McLean. Melanie Fraser is the CEO of Health PEI, which is an organization that was created back in 2010. PEI is also a rural province. It's a province that is largely a community and primary care oriented health system, really because they just don't have the critical mass of population to offer all of the tertiary services, or to be able to sustain all of the tertiary services. And so there are a number of interesting interactions within the Atlantic provinces around how patients from different provinces receive services in other provinces. And so PEI focuses a lot on primary and community care, and is dependent upon other provinces for some of the specialty services. That has created some challenges for PEI, where some of their backlogs are in access to specialty services. But on the other side of the coin, PEI has some of the most development community and primary care systems in the country. They spend about $5,635 a person per year, which is pretty much on the national average. And they have a generally healthy population, good life expectancy, low amount of avoidable deaths. Their challenges, as I said, really do relate to specialty services. So for instance, only 28% of their population are accessing orthopedic joint surgery within benchmark. They also have, as most provinces in Canada do, a significant population that are unaffiliated with primary care teams. And so a big focus on PEI has been around evolving the primary care model. So what's driving change in PEI really is that need to push the primary care model. They have established a health transformation office, which is an office that has oversight from both the Minister of Health and the CEO of the health system. And they've really focused on a number of key priorities for the province. They're focusing on primary healthcare and the team model. Not just, and they are building more teams, but PEI has probably been a bit of a front runner in Canada in that they've also been very much focused on ensuring that the teams have resources to be effective and to be efficient. And so they've had facilitators working in their teams. They've actually invested in really clarifying roles and how team members work together. And they've expanded the concept of team, kind of like Newfoundland, to the neighborhood model because they've recognized that team-based care is about more than just the medical care, but it's also about all of the other things that are in a person's community that can support them in their health. They have made big commitments to improve their numbers in terms of affiliation with practices and to improve wait times, and so their budget certainly reflects those commitments. They've also, under the Transformation Office, is a new medical school in PEI that is obviously happening at UPEI, but in collaboration with Memorial University. They're committed to a significant digital health agenda and likewise significant human resource investments. So in 2025 budget, the total budget's about 1.25 billion. That represents just over a 10% increase for PEI, whereas the Newfoundland budget was about an 8% increase. So as the range that Everton had quoted. Large investments in workforce and training in the budget, 16.8 million for the medical school, 1.1 million for an accelerated medical admin support training program, 650,000 for an international nursing training. And they're adopting a practice readiness assessment program that would probably be similar to one that has been developed in Nova Scotia. They're investing in 103 additional long-term care beds. They've earmarked about $4 million for enhanced home care services. They're as I said, they're increasing the primary healthcare homes, and their goal is to attach 10,000 more people on the island to primary care homes this year. And they've made significant investments in digital health, about $4.8 million to expand virtual care on the island. In terms of pharmacare, PEI is the first province in Canada to sign on to the federal deal. And so they have in May 25, they signed on to the federal program, which includes contraceptives and diabetes medications. In terms of innovations in life sciences, PEI is also a very vibrant community. The province provides a health innovation fund to seed innovation work in healthcare. They've introduced patient safety and patient experience elements to the health system. And I would say, in summary, PEI has quite a mature community and primary healthcare system. They're very much focused on the effectiveness of that system, and now that they have resources in place, trying to enhance attachment to members of the community into those resources. I'll stop there and hand it to Kathie.
Thank you, Brendan, and welcome to everyone who's joining us today. We'll take a few minutes to talk about Nova Scotia's health system next. They play a key role, and they have the largest population in the Atlantic region with just over 1 million people. They offer the most specialized care in the region as well. Of course, New Brunswick does offer specialized care as well. And they have a key leadership role. In terms of the political landscape, it is defined in 2025 by the governing Progressive Conservative Party, which is, of course, led by Premier Tim Houston. They came to power in 2021 and were reelected in 2024. And their platform has been explicitly focused on fixing healthcare. And I would say they are laser focused on delivering results in healthcare. They have strategic alignment across the systems, including healthcare, of course, in strengthening economic resilience, enhancing affordability for citizens, and fostering healthy communities. Their Department of Health and Wellness is overseen by Minister Michelle Thompson, who's an RN with extensive experience in the Nova Scotia health system and a former CEO of a long-term care home. Their Deputy Minister is Dana McKenzie, appointed in 2024, and also has extensive experience in Nova Scotia with multiple previous roles with the government there. They have a separate Department of Addiction and Mental Health, which I think is important because it shows the growing need for those services in the system. That's led by Minister Brian Commer, who has also been in the system and is an RN by training, and their Deputy Minister, Kathleen Trott. They're managed by two health authorities. So there's the Nova Scotia Health Authority and the IWK network. Nova Scotia Health is the larger of the two. They employ 24,000 people and have a very extensive network of hospitals, health centers, and community programs. They were established in 2015, and that was through the amalgamation of 9 regional health authorities, which is something that we've seen across all of the Atlantic provinces as a common theme, that there's been amalgamation of health authorities to try to help enhance efficiency and coordination of healthcare delivery. The interim CEO is Karen Oldfield, and she was appointed in September of 2021, and their administrator is Chris Power. And Chris Power was the former CEO of Capital Health prior to the amalgamation. The IWK is the second health authority, and the IWK is unique because it supports Nova Scotia with specialized newborn, pediatric, and women's health, but it also supports the rest of the provinces in the region as well and provides that specialized care. With respect to the budget, Nova Scotia's 2025-26 budget is entitled Unlocking Our Potential, and they have a strong focus on healthcare as well. Healthcare is actually 44% of their total budget, and they've seen an 8% growth in spending in health this year, totaling nearly $6 billion. This year, Nova Scotia also has made significant investments in infrastructure, which is really important, and also a theme across the provinces that there's a need for infrastructure. It's the largest capital plan in Nova Scotia history. And the CEO recently, the Nova Scotia Health Authority CEO recently indicated that there would likely be a need for more infrastructure investments across the capital region, despite also the current expansion that's already happening, adding hundreds of beds. Similar to the other Atlantic provinces, there's a huge focus on primary care and affiliation. Nova Scotia is currently stating that they have 94,000 residents who are without a primary care provider, representing 9% of the population. And that 9% is a significantly lower number than what's being quoted in the other 3 Atlantic provinces. And they are saying that their unaffiliation rate is hovering the other 3 around 20%. Nova Scotia is using an interesting model for affiliation. They're using complexity scores and considering the needs of the patient in terms of how they're matching them. And they're also looking at the team-based care model and how to make their teams more effective. They have a very strategic focus on recruitment and retention. So they are really aware of the health human resource challenges, and that's a priority there. They've had some significant success, especially within physician recruitment, and they've created the Physician Assessment Center of Excellence. And this is a really key initiative, $10.7 million to accelerate licensure of international medical graduates. It's run by the College of Physicians and Surgeons, and they also have a $22 million investment for a new physician retirement fund. There's substantial investments in nursing, with a 4-year commitment of $3.5 million to expand nursing training, $2.3 million for the Patient Access to Care Act to look at recruitment of a broad range of healthcare practitioners, again, considering the importance of team-based care. And of course, they have a new Master of Physician Assistant Studies at Dalhousie that started in 2024 that should graduate 24 people per year. They are really leveraging digital health. So a lot of initiatives in that area. The One Patient, One Record initiative, which is just over, it's $90.9 million for implementation. Really ambitious project meant to digitally transform health records across Nova Scotia, very patient-centered. Looking to consolidate health information, and progress is ongoing with that. They have Virtual Care Nova Scotia, and that helps both attached and unattached patients access care. There's a different level of care provided if you're attached or unattached. And if there's in-person care needed, they can go to another clinic. There's virtual urgent care, virtual hallway, and And of course, Brendan mentioned the innovation hubs in the other provinces. There's the Nova Scotia Health Innovation Hub that has an emphasis on a test and try model, which is really important. And last but not least, they have pharmacare. They have a number of their own provincial pharmacare programs. Notably, they have not yet signed an agreement with the federal government, and they are indicating that they're going back to the table for further discussions and trying to secure the best deal. And this indicates a nuanced and innovative approach to securing sustainable healthcare funding. So the key takeaway for Nova Scotia is strong alignment, laser focus on innovation, laser focus on trying to improve recruitment and retention, and focus very much on the health home and health neighborhood model that we're seeing in the other regions. And they have the highest quoted affiliation rate. In terms of New Brunswick, they are the second largest province by population. Majority Liberal government in New Brunswick was secured in the fall of 2024 during the provincial election. And the province is now led by Susan Holt. And of course, prior to that was Blaine Higgs. The key ministerial appointments are the Minister of Health is Dr. John Dornan, and he is a physician who is an endocrinologist and was also previously the CEO of the Horizon Health Network. The Deputy Minister is Eric Beaulieu, and he was appointed in 2022. They also have a minister responsible for addiction and mental health services, which is Rob McKee. And he has been a longtime advocate for mental health, New Brunswick's health system in 2025 is focused on improving access, enhancing patient experience, and financial sustainability. They also have two health authorities, Horizon Health Network and Vitalité. And those the two health authority model was established in 2028 after they also amalgamated their previous regional authorities for improving efficiency and coordination. Horizon Health is the larger of the two, with 12 hospitals and over 100 medical facilities. Their strategic plan, most recently, is entitled Redesign the Way We Deliver Healthcare, and is centered on a community-first approach, emphasizing delivery of care closer to where people live. They are prioritizing excellence in acute care services, providing a robust support for health teams, and fostering research and innovation. A notable difference with them is they collaborate with the New Brunswick Health Council, which is an independent body meant to provide unbiased oversight and reporting on the performance of the healthcare system. Vitalité is unique in Atlantic Canada because of its distinct Francophone identity. It primarily serves the northern and southeastern regions of New Brunswick, and they, of course, provide healthcare services in French and cater to the cultural needs. With respect to the budget in New Brunswick, the budget is entitled Driving Change and Delivering Progress. They are prioritizing healthcare, education, housing, and economic resilience. They're forecasted to spend $4.45 billion in healthcare, representing an increase of 7.7%. Their mental health spending is 6% of the budget, which is just significantly below CMHA's recommended 12%. And they are projecting a deficit this year of $599 million. And of course, all the regions are projecting deficits. And New Brunswick had previously been in a surplus position. In terms of the primary care model they're also pursuing team-based care, and they're taking a primary care first approach. They're establishing family health teams with $30 million allocated for the teams and community care clinics, which again, I think demonstrates a clear commitment to primary care. They have a stated commitment to establish 30 health teams over a 4-year period, and want to have 10 more within 2025, 2026. Horizon Health also set a goal to match 10,000 patients by March of 2026. They aren't just focused on affiliation, they're looking at access. And their goal is to ensure there's access to primary care services either virtually or in person within 5 days. With respect to their workforce support and their HHR challenges, they budgeted $15.9 million for physician remuneration and community-based practices. And they have $2 million to expand recruitment to other qualified health professionals. They have an aging with dignity priority as well, with $22 million budgeted for nursing homes, specialized bed, $10 million to make home care more accessible and more affordable. New Brunswick is also very focused on innovation in a number of areas, with a number of projects occurring. And with respect to pharmacare, they also have a multitude of provincial programs. But in terms of the federal pharmacare agreements, they signed a $32 million agreement with the federal government for rare disease drugs. And that was effective December 19th. And in summary, New Brunswick's system is characterized by a new political leadership and strong alignment. There may be some significant fiscal challenges as they go ahead, and they're very focused on primary care, the patient medical home, patient medical neighborhood model, with which they're calling family health teams, and they're focused on recruitment and retention as well. And I'll hand it back over to you, Everton.
Thanks so much, Kathie and Brendan. Some great insights there, and really appreciate those. Excuse me. As I draw out some of the interesting threads that you spoke about healthcare operations in Atlantic Canada, it strikes me that we need to look at Atlantic Canada with two lenses. One's as provinces, we see what's happening individually within their borders, but also look at the opportunities for regional cooperation and how they work as a region, as I talked about at the beginning. An example of recent work between PEI, New Brunswick, and Nova Scotia to try to establish some formal agreements that allow specialized care to be carried out across the region, as opposed to previous aspects where people would refer out of province, but not be sure that there's like a formal agreement or pathway to care. And those things are being worked out now between the provinces. The populations, as you know, don't really allow for multiple specialized areas of expertise across each province. Instead, we see them in, for example, the IDUK for pediatrics in Nova Scotia, serving the whole region. And Newfoundland Labrador, of course, has its own pediatrics with the Janeway Hospital. And then these centers of excellence, of course, across the region that support the entire region. But beyond those operational pieces, I think what's equally important is that we're seeing how the provinces watch one another and adapt to each other's ideas, because there are those similarities, and they're able to take them and make them their own and make them work within their own borders. I think that's a great interchange of knowledge between the provinces. For example, we see PEI this year moving forward with international licensing projects similar to Nova Scotia's PACE program that licenses international physicians, and is one that we're really looking forward to seeing more growth on. That's an area I think the region can become even better at. There's room for the region to look within the different provinces here, because they do have some similarities, but also across Canada, and adapt and become incubators of innovation. The small size of each province allows that kind of incubation to be grown, innovation to grow, be tested, and really export it. And that's one of the advantages of Atlantic Canada to the rest of Canada, is I think we can be a hotbed of innovation here to grow. In that same vein, provinces all have a major thrust to working with industry to advance research and development. We talked about innovation hubs to build for-profit, sometimes businesses that can provide services and become really agents of change across the health system. Also, we see places where we're growing the biosector across provinces. Prince Edward Island, I love to point out this example. We have 180,000 people, and we have a bio-alliance that's and the biosector cluster here that's producing over $600 million in revenue, and is expected to hit the $1 billion mark in just a few years. It's really been a center of excellence, and we're seeing that growing to similar goals in Nova Scotia with Life Sciences Nova Scotia, Research New Brunswick, and in Newfoundland Labrador, as Brendan had mentioned. So these hubs, Research NB, Bounce Health Innovation, and now some of these agencies are really growing the innovation and giving Atlantic Canada a leg up, taking advantage of its natural opportunities to advance. Also, when we look at all of the region as a whole, I think the key advantage that this region has is that both political systems and health systems are willing to try new solutions, find ways to improve access to care, and they really have an imperative to do so. They've both been politically have imperatives because their elections are coming up and they've committed to this sort of change, but also the populations are asking for it and there's a real need for it. So we've been weighing into more innovation, more change, moving a little faster, setting up structures to move faster. And we've seen that be more prevalent over the last 5 to 10 years. So that's a growing thing. And I think Atlantic Canada, because of that, is a region to watch from across Canada. So with that, I'll hand it back to Avis to take some questions, and we're happy to have a chat with the group.
Great, thank you. That was really interesting. And I love hearing team-based care across the country, finally, because it seems to be the root of getting at preventive health care, which reduces costs down the road. So my first question, and we are getting questions from people watching, but I would like to ask, is there anything in the Atlantic regions that other provinces should look at and say, hey, this is a really good idea that they're pioneering out here? That no one else has really done? Or are they just, is it iterations of what's happening across the country? Kathie, do you want to start with that?
Thanks, Avis. I think that, the Atlantic region was early in the adoption of team-based care. And I think that while team-based care isn't something that is necessarily new, we've tried that before in the past. What is different in the Atlantic region is the how. So if you put a bunch of people in a room and say, go be a team, they're not going to go be a team. You have to work with them and you have to help people understand how to be a team in a different way. Being in team-based care in 2025 across the region means working to full scope of practice. It means practicing in a different way where we ensure that when the patient is entering the system, the physicians or the nurse practitioners aren't the bottleneck. We're not the gatekeepers that then have to refer people off to other people. So now being a team in 2025 means that for patients, there should be more accessibility to a broader group of providers. So you should be able to call your team and you should be able to tell them what your complaint is. And then the first person you see might be a physiotherapist, or the first person you see might be a dietitian, or the first person you see might be the LPN, versus, when we did team-based care in the past, you had to go see the physician or the nurse practitioner before you saw everybody else. And that created backlogs.
So shortening that line and reducing the waiting. So you think other provinces haven't got that yet, or they're still moving towards that? So that's something they could learn?
Yeah, I think that it's about that. And I think the other unique thing in the Atlantic province is the use of practice facilitators to help with that, help the teams work with that. And also allowing the teams to work on their own quality improvement initiatives, like say what's important to us and our patients, and how do we work through that as a team to make the care better.
Okay, here's a question from a viewer. I'll send this to Brendan. What is the single biggest opportunity, in your opinion, for the Atlantic healthcare in the next 5 years?
Thank you. It's a great question. I think I think this question goes along the lines of what Everton was speaking to. I mean, I think I think the fact that Atlantic Canada as a region relies on its interdependence, like for to achieve scale, like to achieve to kind of they're actually quite practiced at it in many ways. And I think the biggest opportunity is for them to actually own that and lean into it and say, we're going to actually become one of Canada's best integrated regional network. And that would look a little different than what we do today. So that we would still see most of the specialty services, for instance, being delivered by the IWK Health Center. We would still see probably a lot of the high-end specialty services happening in Nova Scotia or New Brunswick. And when they were getting together to think about planning those services 5 years out, they would be clearly planning from a frame of reference, which is the regional reference point, and they would be clear about establishing the relationships and the expectations of the different partners in that upfront. And that would deliver huge benefits to the programs, because they would be able to develop a program at the scale of a region, which would mean that they would have more resources because they would need more resources. It would be more sustainable, higher quality, And it would mean that the participating other, provinces would have the assurance that they would be able to access those services because they're actually a partner in it, as opposed to being on the other side of an agreement that says we would like to purchase these services from you. So, and I think that this would be, leading for Canada, and it would be good for healthcare, and it would also be really a good model for our country in terms of how should we be generally working together as a country and regionally to ensure our sustainability and our resilience, and in this case in healthcare, but the same thing could happen in other sectors.
Really interesting. Okay, well, leading up to a question from another viewer, and I think it'll go to Everton, but Fury is now leaving politics. And do you sense that having a physician as a leader helps drive up the healthcare agenda in there? And do you have any insights on the upcoming election in Newfoundland and whether that's still going to stay at that high level?
So a physician leader as a premier is an interesting thing for sure. There's great insights that Premier Fury had brought to the system, and I have no doubt that had helped buoy the innovation lens, the changes in surgical practices, the wait list, and the movement to team-based care. I think he did a great job of that over those years. I don't think that that's going away with the new premier. He was most recently the Minister of Health, understands it. A little bit of an interesting move, really, removing the sugar tax in Newfoundland and Labrador, which had a little bit of impact and probably would have had more impact if it continued to reduce things like diabetes and obesity. So that was an interesting move, and I don't want to read too much into that, but I know he understands healthcare very well. Very capable Minister of Health with Krista Lynn Howe, actually from where I grew up in Newfoundland. And I think they have a good forward-looking agenda on healthcare. I don't think that changes. I do think with the upcoming election, you're looking at positioning around. Everybody's going to position around access. Everybody's going to position around how do we actually get people into care. Brendan mentioned the NL Health Accord, which is an important document. It's a 10-year document. It really has a forward-looking agenda and focus on things like the determinants of health, which kind of went away for the past few years. When we talked about COVID, people stopped talking as much about that, and there's been a shift back into it. I see in New Brunswick, there's a new population institute with UNB there. That's really important. So we're moving more in that direction again. I don't think that's going to change if the Liberals become reelected. I do think there'll be a change in strategy, and the documents will all change. If, for example, the competing progressive conservatives who are sort of neck and neck end up becoming elected, I do think there's going to be a little bit of a push around financial sustainability and accountability. How can they measure that the money being spent in healthcare is actually getting results, especially with things like the Kai report saying despite expanding access, we're still not meeting targets. So I think all of that's going to play out in this election. I expect it to be a heavy health piece, but also a heavy economic election. In Newfoundland and Labrador, one to watch for sure, at least by October, if not sooner.
So clearly the voters in all these four regions have had a big say in what's happening.
Oh, for sure. The voters have spoken, and when I hear from people who go door-to-door campaigning, the politicians I've spoken to is that they hear healthcare. Previous elections a lot. I think in the federal election, it was less because the tariff issue had overtaken healthcare, and we see that in even the policies of the federal government. But provincially, it's still, if not the top, the second priority, and very quickly, I think it becomes a top priority again as tariff issues subside, assuming we get the deal. So it's a thing to watch. I do think it'll be a driver in the next election, Newfoundland Labrador. The rest of the election is a little bit further out, but it'll continue to be important.
Based on a viewer question about mental health care, as you mentioned, there are targets that are put into place and mental health problems are increasing. I know that Nova Scotia has gone the private route, and there was some pushback from the union about taking that approach. But viewers asking, is mental health care a part of primary community models in any of these Atlantic provinces, or is it separate? Who wants to take that one?
I'll just say they are. I know on PEI, for example, community health clinics have mental health embedded in them, but I think Kathie is an ideal person to speak to the details from an expert knowledge perspective.
Yeah, Kathie?
Yeah, so I mean, mental health is a huge component of primary care. I'm a family physician, and I would say, on a day-to-day basis, a third to a half of what you're seeing is mental health related. And so there's a significant amount of it that's addressed through primary care and team-based care. And there's a lot that happens before you get to super specialized care. And so I don't think there's ever a plan to remove it from primary care. And there's been a big push to move towards collaboration and the integration and coordination across not just the health teams that are providing the primary care, but within the neighborhood and the broad resources within the neighborhood. So no matter what you do, mental health stays, and Nova Scotia and New Brunswick both have separate ministerial priorities for mental health and addiction. So I think that it's growing, and how we've traditionally provided care may have to change slightly, but the focus is still to provide that within the community. Mm-hmm.
The volume of demand, it is huge, right?
It's huge.
It is huge. Can I jump in on this, Avis?
Okay? Go ahead.
I agree entirely with Kathie's comments. Another way to think about it is in provinces establishing a separate ministry around mental health and addictions. What they're signaling is that the province understands that this is a significant, like a very important priority for the province, for the population.
How many provinces have done that? Set up a separate ministry?
I know BC has, Newfoundland, Nova Scotia.
Okay.
Yeah, so I don't know about.
But that's happening.
A separate ministry, but there's a tendency for it to be happening, and one way or another, provinces are signaling that they're a commitment to mental health at at very senior levels, which is important. The other side of that, the unintended consequence, it can be one of the most important things with mental health, is that we want to make sure that mental health is not something that is isolated and that we're stigmatizing people around mental health. And so it's so important that mental health services are fully integrated into these primary healthcare teams, because Avis, yes, we're probably seeing there probably are more mental health issues, and I actually think that we're just seeing more of what was always there. Like it's both and so and part of that was because in our former systems there was a lot of stigmatization around mental health, and I think the CMHA and other people have been working very hard to try to break that down. And we need to if we're thinking about primary healthcare, those teams have to be built with a large focus and energy around mental health. And then we should be using the energy from the provincial leadership to be saying, and then how do we increase services, specialized services, whether that's recovery, whether that's for other specialized mental health services. So. But whatever we're doing, we have to do it in an integrated way. It has to be connected.
Mm-hmm. And I would put in a little good word for making sure the mental health prevention at the primary school level, secondary school level is there, because parents are stressed, children become stressed, and then you have a lifelong history of problems. On to another viewer question, and I think this will go to Kathie. One of our audience members is curious about what Nova Scotia Health might be doing about chronic pain. So we're getting into that bigger issue of chronic health issues. And is Nova Scotia or are any of the provinces recognizing that big burden of chronic illnesses that often come with the demographics of an aging population? Big question.
Big question. So I can't speak specifically to whether or not Nova Scotia has a chronic pain initiative specifically.
They do.
Okay, thank you, Brendan.
Yeah.
Yeah, and again, and so Brendan, maybe you can talk specifically about the chronic pain.
I'm happy to. Yeah, I mean,
initiative.
Because I think if I'm understanding the nuance of the question, it's a great question. So yes, Nova Scotia does have considerable expertise around chronic pain and chronic pain. And we also are very much challenged to make that expertise accessible to people in rural communities, to seniors, and so I think that's kind of one of the transition points of the system is that okay, how do we if we develop a specialty service, how do we find ways to make sure that it can be accessible? And that usually brings us back to a connection with these primary healthcare teams. And it usually brings us back to some kind of a collaborative care model with primary care teams, so that that specialty service isn't trying to do everything for chronic pain. We want to be building more and more capacity and capability within a primary healthcare team so that they can actually deal with most of the chronic pain stuff, that they've got provincial guidelines, that they've got experts that they can turn to for as resources. And then for people who really, really need ultra specialized care, they're going to go see Dr. Mary Lynch in the chronic pain program and get looked after.
Okay, I want to get through 3 more quick questions because our time is running out. These things all these interesting questions come in. Why are there a couple of provinces that still haven't signed on to pharmacare? What's the holdup? They want to squeeze out more money.
Kathy.
Want to squeeze out more money? I mean, I think people legitimately are waiting for access to it.
I think the answer.
Yeah.
Sorry, I think the answer is that they are trying to negotiate. That's what they've said, try to get the best deal for their province, still in a negotiating stance, but also in a stance where they know they need to get moving. I do think we'll see some movement over the next several months on those. But it is a little bit playing that fiscal game, trying to make sure they get the best deal and ensure they have the right coverage for people. There's these agreements are never perfect. There's sometimes difficulty implementing them, getting them to work just right in each province. So I can see why those governments are taking a little bit of that approach. And of course, we just had the election, moving into a new government who's going to be negotiating those. So I think hold tight, something's going to be coming. I expect they're all signaling that they're interested in it. And it's a matter of when and exactly how.
And I guess a note is that they're very voter sensitive, these provinces.
Yeah, absolutely.
So if voters are listening, so do that. Okay, let me move. Yeah, go ahead.
I just want to say that the small provinces mean that if you're a politician, you know everybody and you know them from all, you're very visible. You hear from the voters every day. The voters' intention makes a big difference in your day-to-day life as opposed to just when election time comes.
Fantastic. You mentioned innovation, all of you. Is there one particular innovation that you've seen coming out of the Atlantic region that you would like the rest of the country to know about? And I'm thinking about the hubs that you're discussing. Is there anything there? Anything you want to touch before our time is up?
I would say that I think what's really important is the one patient, one record. I think that making sure that patients have access to their own information, but also making sure providers can communicate with each other. Because if the teams are going to work, if the health neighborhoods are going to work, people need to be able to communicate and share the same information and know what's happening. So, the MyNS portal, one patient, one record, but then there's also non-technology related innovations that are important as well, like looking at how we work differently together. So the community pharmacy clinics in Nova Scotia are super interesting as well, and how they work
sure
with the
are.
teams.
They sure are. I met them, and that is another way for people to get basic care. Brendan, anything you want to add that you've seen that take a look at?
Yeah, I agree. What excites me the most is that we're seeing an evolution in this innovation space away from just innovations that were around a device or a drug or a particular care process, to innovations in terms of how we can kind of hack the system and create more innovative models or innovative approaches. And we're seeing that with different partners at play. So like these pharmacy clinics, are a good example of that, where they're kind of the not the usual suspects are coming together to create innovative models. That really excites me. I will put one plug in for, there is one innovation in Nova Scotia called Virtual Hallway that was developed here. It's essentially what I love about it is it was developed by a group of physicians who recognize that one of the unintended consequences of these large health systems is that it kind of depersonalizes the medical community, that we lose contact with each other, and collegial contact, amongst health professionals, physicians, nurses, pharmacists, is essential to good teamwork and to good quality of care. And so Virtual Hallway has created a simple web-based tool where family physicians can get connected with specialists. If they have a question about a case, they're not sure that they need to make a formal referral, they can connect, they can get some help. I think it's wonderful. Sorry, I'll stop talking. Thank you.
Great. Okay. Everton, last word, and then we're going to close up before
Sure.
10.
Yeah, sure. No, I just have to say I'm a little bit upset with Brendan for stealing mine because virtual hallway was on my list as well. I was very happy to see it extended out into PEI, so those primary care physicians can reach to specialists through that, and it's very important. I think that speaks to the leveraging from one province to the next. That's something that we're doing. We talked about the biohub situations where they're really advancing. I think the major innovation in Atlantic Canada is the way we do innovation, and that's a little bit meta, but that's the thing that really is going to make a difference for us, that we have these hubs that are growing. And if we can get them to work as one region and really synergize, I think there's a great opportunity for Atlantic Canada.
Fantastic. Okay. I love these sessions because I've come away having learned something. So I want to thank all of you, Everton, Kathie, Brendan, for this discussion. I want to thank everyone who's been watching, with a reminder that a copy of this will be emailed to you, but it'll also be on the Santis website for your review or sharing. And I want to thank you for spending your time with us talking about Atlantic Canada. It's a learning opportunity wherever you cast your eye and start talking to people. So on behalf of the Santis team, thank you so much and have a wonderful day.